When teaching classic pigeon pose to beginners, it's a good idea to teach them the feel of the posture and give them some support before you take them into the classic down-faced dog, bring the right knee forward, say, to pigeon. Because it's in that transition that they can hurt their knee joint. So to beginners, I set it up where we start on all fours, and students will have a blanket and a block ready right next to them so they're easy to grab. We'll stand on all fours, and I will say to take their right knee to the right wrist, and then without grabbing it with your hand or anything, wiggle the right foot across to the left side of the mat. It's important they don't grab it because they can overforce the knee joint. And then once it's where it wants to be, begin to slide slowly back with the left leg, trying to sit that right buttock down. They can sit a little bit out to the side. You're wanting to keep the pelvis nice and stable. And this is where the blanket comes in, or for people who are tighter, a block or a bolster. So I'm going to sit that blanket under there and then use that as some really firm support so that I've taken all of the weight out of my knee joint. If I have no knee pain now, I can proceed further, coming down onto elbows. There I'm making the deep flexion at the hip joint. I'm firming the back leg, trying to internally rotate the back leg, so simultaneously sitting out into the right buttock and bringing the front left hip closer to the floor. It's quite nice then to rest, and I quite like to grab the floor and push away from the front of the mat to get the weight out of the knee and into the hip joint. And for people who have extra heavy brains or who have tension in their shoulders, it's very nice to place a block underneath their head as they rest. As they progress, they can go lower, reach forward, but there's still that feeling of sitting back into the hip joint. Eventually, over time, this foot will come further and further forward, but people who force that foot forward will probably ask their knee joint to do what a stiff hip won't do, and that's the potential for injury. To come out of it, we reverse it, tucking the back toe under, coming slowly up into all fours, and then we would proceed and do the other side.